interested in.
Okay. My name is Smitha. I'm from Minnesota, and I hope to go into psychiatry.
Psychiatry?
Yeah.
Did we do anything psychiatry-based here?
Not yet. We might see the psychiatry word.
Fantastic. And did you meet the guy, the suicidal guy?
Yes.
Did you learn anything psych-related from that?
He was not, in a position to be able to speak with us, but it was more about his kidney problem, because he had to get kidney dialysis. So, yeah.
Got it. Okay, and did you go to the Philippines program, or is this your first one?
No, I did not. My sister actually went to the one last year.
Okay, is that how you learned about this one?
Yeah,
and she suggested it?
Yeah, she liked it so much that she told me that I should probably try it out. So.
Fantastic. Okay, so tell me maybe one of your most favorite experiences since you've been here.
My favorite experience was probably when we went to the urban center, the urban medical health center, because we saw just regular people and a lot of little kids actually that were just coming there to get basic aid, because a lot of them were just too poor to be able to go to a nicer hospital. But it was just really interesting to see how well the doctors and everybody there really cared for the patients, despite the fact that they got paid very little and worked very long hours, and that just showed how dedicated a doctor has to be. And it also just showed I think to everybody just the humanitarian side of medicine. So that was,
which is really important, because in the States I think you get exposed a lot to the technology and the science, right? So is that something that you've sort of seen across the board with the doctors here, their dedication to really healing people? Were you aware, was there anything like that or an experience like that?
Yeah, I felt like they were extremely dedicated to their patients. And of course, doctors are dedicated to their patients no matter where you are, but this was a completely different level. This is something that you don't get to experience in the United States, because there isn't as much direct interaction with a doctor and a patient in America, because of all the technology and how infrequent checkups sometimes are. But here, despite the fact that they had so many patients, they had to spend a lot of time with each patient because of the long hours, which it's mandated against in the United States, but here they're allowed to do that. So they have to spend long hours with their patients, and they really get to bond with the patient because of this lack of technology that they have.
Fantastic. And did you learn anything at all about public health while you were there?
Yeah, we learned a lot. We had an entire day on community medicine, so we learned all about the different levels of medicine and how they are involved, in a rural setting, in an urban setting, and then in a hospital in general, and a less developed country and a more developed country. So that was a very interesting experience.
So you guys did that actually before we came. So could you describe it to me, because we didn't see it, and pretend I'm somebody who wasn't here? Can you how far out of the city did you go? Where was it? What were the conditions? Just give a little bit more description.
We went about 45 minutes out of the city into the urban medical centers, and then the day after we went to the rural medical center, and we just met with all the doctors. A lot of them were for doctors for pregnant women and just children's health and things like that, and they basically just told us what their patients needed and what they did to provide that care, and then the differences between an urban hospital and a rural center, a lot of which was quite different. Cost was definitely something that came in. A lot of the patients who come to these medical health centers are very poor, so they didn't have to pay very much to get service, which was something that was very heartwarming to a lot of people.
And why was that your favorite experience? What touched you about it?
Just seeing all these patients that had practically nothing, but they still were so happy and still getting the care that they needed. I think just emotionally that was just a good experience.
You just gave me something very unique. Nobody's talked about that part of the program yet, so this is perfect. So I'm just going to wrap it up and ask you every question I asked, or the question I asked to everybody is, were you somebody that knew you wanted to be going into medicine, or is it something you were kind of on the fence with? I
decided that I wanted to go into psychiatry specifically, I think in the 6th grade, because I have a relative that works in psychiatry, and I just know a lot of people. Everybody needs a psychiatrist at some point. I feel it's something that no matter what, you're always going to be working, so that's good in terms of job security, and it's also it's just that's something that I feel with help with like mental health is like something that there's such a huge stigma behind, and a lot of people just don't get help, even though it's probably something that almost everybody needs, and it's something that people just don't get help with. So that's something I want to try to like bring more awareness to and help more people, so that because it's terrible to live with any kind of mental health issue. So
No, that's very, very good point. I studied public health and mental health, and I make films about health issues, and mental health runs across every single issue I cover, but it's very rarely addressed, you know. Anyway, so the last question is, if you were to meet somebody who didn't know about the program and they were on the fence about coming, what sort of advice would you give them? Would you encourage them to come? Yeah, what would you say to them?
I would just say go ahead and go for it, because this is like a type of experience that you probably won't be able to get in the United States, and it's kind of like a once in a lifetime opportunity, especially to get this kind of experience like firsthand so young, when this is something that most people would have to wait until medical school to get into. You get to experience in high school, which is like a completely out of world experience. So definitely go for it if you're on the fence, because it'll either affirm your love for medicine, or you'll realize that maybe you have like your career path somewhere else. So either way, you'll kind of figure out what you want to do.
And do you think this is going to strengthen your application to medical school?
Definitely, yeah.
Why do you think that?
Now you have more firsthand experience with patients, and you just have more of an understanding of the inner workings of the field, which I think looks good on any kind of an application. So.
Excellent. You're great. Perfect.